So most of you came to our clinic because of pain. And pain is a great motivator, let's face it. When there's a fire burning, we need to get that put out and move on. Have you ever been to a massage therapist or done some exercise and sat down and realized you're really sore and you didn't even know you were sore? Well, those pain fibers were always firing, it's just you weren't aware of them. So when we're using pain as a guide on what to do, or should I continue to come in, it's not really the greatest when you think that only 10% of those fibers are being perceived by the brain. So at the Posture Clinic, we have many different modalities that help you to get yourself out of pain and start getting back on the track of healing. One of our first ones we love is the shockwave. Shockwave sounds scary, but what it really is it's a high pulsed ultrasound. And the shockwave, what it does is it takes that same sound wave and puts it into a very, very small and focused beam, so it penetrates much deeper. The idea of most therapies is that it increases blood flow and it actually breaks up the adhesions. So when muscles and tissues get injured, they can't no longer connect anymore. So they're sort of like sitting here, so there's no bridging. When the tissues can't bridge, they can't repair. What this does is it breaks up the adhesions so they can come back together and then they can heal. It brings oxygen into the area, gets rid of waste products, which is crucial for healing. And the last thing is it's been shown to start angiogenesis, which is really exciting concept, and that is growing new blood vessels into the injured area so that the body can not only heal but stay healed. Another great therapy that we have at our clinic are our computerized spinal decompression rejuvenation tables. These tables on their own have been shown to be somewhat limited in the research, but combined with all the other therapies that we do, we find them extremely helpful. When you think about it, life is very compressive. On Earth, we have about 14.7 pounds of pressure on our bodies per square inch. So think of a large bowling ball sitting on every square inch of your body. That's what gravity does to us here on Earth. And because we grew up in it and we don't know any different, we don't actually even feel it. But believe me, it's there. If you've ever fallen off a ladder or from a distance, you know gravity's there. It lets you know pretty quick. And you do a lot of damage in our joints and spine, again, is done because this tremendous force is pushing down. So if our alignment's off, it creates lots of pressure, inflammation, and other things that cause pain. So the spinal decompression table, what it does is it's like putting you in space. It allows your spine to decompress. It pulls everything apart, and it takes some of that compression on our spine and alleviates it, even just for a short period of time. I used to think that it took a lot of pressure to take the pressure off a spine, and we found that it's not true. The decompression, the amount of just distraction you need is very little. Once you take the pressure off, the blood flow can then come back into the area, and that's a great thing. The other thing that you need to do is you need to rehabilitate the tissues that you're stretching apart, and they're primarily the spinal discs. And we'll just show you a picture here of the spine. And as you can see here, you have the vertebrae here in your neck. There's 7 vertebrae, and you can see the spaces in between. And these spaces represent the discs. And the disc can be rehabilitated both by our spinal rejuvenation table, which is going to stretch it out. It will also be done with a home traction unit that's specially designed not to injure your neck, and of course it reinforces it because you can do it every single day, like brushing your teeth. We also have the Wobble Chair, which has the same effect of stretching out your low back disc, and it allows the blood flow around the area. The disc absorbs the fluid and gets rid of the waste products, and we've actually shown increase in disc height here. We actually did a research study about 10 years ago and showed that you can actually increase the disc height, which is pretty exciting when we found that out. And these therapies are just some of the many tools that we have in our clinic.